My name's Mark Weiss, and I'm the Department Chair of Counseling at Lynn Benton Community College in Albany, Oregon, small rural community college near Corvallis, where I live, and I have lived for over 30 years. My story is around death, and that I am now watching two different kinds of deaths. One is that we have many students, many students, without any health care available to them. They don't have health insurance, and that clinics and mental health clinics are more than overfilled. As a counselor at our counseling department where I work, our goal is not to provide long-term therapy. It's short-term crisis work, and career counseling is our main focus. So we refer people who need some serious mental health help. But the sources have really dried up, and without health care available on any sort of national level or statewide level, then students literally will die. We have many students who are homeless and trying to find a better way of life for themselves. They don't necessarily make it, and we have to watch that. On the second level, I'm watching my institution die. I'm watching the college struggle with 15 to 20% increases in health care costs for health insurance for the employees, which the college certainly can't afford, just in the way that small businesses can't afford, and really large businesses can't afford. So it's been very disappointing to me to listen to the presidential campaign, and literally every presidential candidate says, I will help provide universal health care, but what they mean by that is keeping it with employers. And will provide congressional level health care for those who don't have a job. And that changes nothing. Employers are going out of business because of healthcare costs, just the way homeowners this fall have lost their homes, primarily because of healthcare costs. That's the single most common factor in families who've lost their homes, is high level of healthcare costs. So as I watch these two kinds of deaths going on and begin to look into things, then the solution that I see is what's referred to as single-payer universal health care. Single payer would put the government in charge of pricing and handling the money for health care. And the advantage to that is that 35 cents out of every healthcare dollar goes to an insurance company right now, either in the form of profits or in the form of doctors hiring assistants and medical clinics hiring assistants to fight with the insurance companies. In real terms, I believe that healthcare is a spiritual issue. It's how we bring together the folks who need help with the healers of our community. And we need to look on it that way. But we have some money changers in the temple of healthcare, and that's the insurance companies. They take in the money and they try not to let go of it. And that's their job, is to pay out as little as possible. And so Blue Cross in 2007 set their all-time record high for profits, and they set their all-time record high for denials. Well, that's just spiritually wrong, and we need to do something about that. The way out of all of that, the way of saving employers, and the way for financial costs they can no longer afford, and the way of making our healthcare system more spiritually based, is single-payer healthcare. So when a person makes the suggestion of single-payer healthcare, the folks listening typically assume this is going to cost a lot of money. They imagine socialized medicine. These things are not necessarily the case at all. Single-payer would not cost more money than the current healthcare system. In fact, it likely would cost less money than the current healthcare system. Part of the reason for that is what I said before, that the profits to health insurance companies and the cost in wrangling with health insurance companies would go out. But a large part of that has to do simply with the size of the pool, the ability to sway costs and that sort of thing as well. It's important to actually take the time to do the math, as my wife did, and figure out what the costs are now for health insurance. My employer pays a certain amount a month to cover me. I pay a certain amount more to cover my wife. Then my wife and I have out-of-pocket expenses, co-pays, etc. This all comes to about $1,000 a month. Well, you can buy a lot of health care for the public when you start talking about $10,000 and $12,000 per couple, and maybe $6,000 for a single person. That buys you a lot. There's a lot of money in the healthcare system. In fact, the only nation on earth that spends as much money on healthcare as we do now, the only other country is Sweden, where they have, in fact, universal single-payer healthcare system for every single person, which the United States does not have at all. They have sort of a top-of-the-line system, as good as there is in the world. We pay just as much money per person. We have people totally uncovered, millions of people totally uncovered. So it's important to know that single payer does not necessarily cost more. Most countries who have a single payer system are paying far less than we are in the United States. The power of the pool is important, that there would be then millions and millions of people in the same system, and therefore we would have a lot of power in that system. That's an important factor financially. It's also an important factor in terms of quality. What you get then is the effect of every politician, every CEO, loudmouths like me, advocates, in the same system with people who have no ability at all to advocate for themselves. And we all end up in the same system. And those of us who are good at arguing the finer points will make sure that that system is functional and strong. We won't settle for less. And therefore, then, those who cannot argue for themselves will gain the benefit of that. Again, getting back to the spiritual aspect of the common group benefit. So with that, thank you.